Today, I am reporting that we have identified 28 new cases of COVID-19 in Alberta in the last 24 hours. This brings the total number of cases to 1,451. Of these, 592 people have recovered. This is 74 more than yesterday. We suspect that 192 total cases of our total cases may be as a result of community transmission. We have completed 1,333 COVID tests over the last 24 hours. We have also had an increase in people accessing our assessment centres since we expanded the testing criteria yesterday, so I anticipate that our testing numbers will increase over the coming days. Sadly, I must report an additional 3 deaths from COVID-19. A woman in her 80s in Calgary zone, a man in his 70s in Edmonton zone, and a woman in her 60s in Calgary zone. I want to offer my sincere condolences to the family and friends of these individuals. One of these deaths was linked to a continuing care outbreak in Calgary, highlighting yet again how important it is to protect people in these facilities from being exposed. We now have 151 cases of COVID-19 in staff and residents of continuing care facilities. Earlier this week, we tightened rules on visitors to these facilities to help protect residents from COVID-19. I know it is difficult to no longer be able to visit loved ones who reside in these facilities, but this measure was necessary to keep everyone safe. Of the 3 deaths today, no, none of the 3 that I'm announcing today were from Mackenzie Town. With respect to staffing situations, I know that many of the facilities across the province that are having outbreaks are having challenges with staffing because, of course, staff who have potentially been exposed to a case do need to be in quarantine, or those who are ill are not able to work. And so that is something that my local colleagues in Alberta Health Services are working with the facilities to help navigate through that, to make sure that staffing is supported, while at the same time that the residents in those facilities can be cared for safely. My understanding is that Shepherd's Care Kensington has 17 confirmed cases. They do have several different units at Shepherd's Care, and it's my understanding that the cases are in the independent living portion of that facility. So there has been efforts made to restrict any movement between the 3 different parts of that facility. And again, it's my understanding that that is underway, that our local Edmonton Zone medical officers of health are supporting that facility to make sure that all outbreak precautions are taken, and that they're limiting spread into some of those other wings where there are more vulnerable people. We have expanded our capacity through the weeks that we had a very high demand for testing with returning travelers. We worked very hard to expand capacity, and I want to say thank you to people who work at HealthLink 811, to those who developed the online assessment tool that Alberta Health Services is using right now, because really through their hard work, they were able to expand our ability to have much more efficient intake of those who are eligible for testing. And so right now, I really encourage anyone who meets the criteria for testing, who has symptoms related to COVID-19, and then meets those eligibility criteria that I talked about yesterday, to go to the Alberta Health Services online assessment tool. I was told by my colleague in Alberta Health Services that within the first 2 hours after yesterday announcing the expansion, that there were over 500 people who had already completed that online assessment tool and were being set up and arranged for testing. And so I don't anticipate that we will see the same kinds of delays that we saw in the early days of testing. With respect to the numbers I would anticipate, that's been a very difficult thing to guess. And so we have expanded every 1 to 2 days since late last week, we had our lab caught up with all of the backlog of swabs and simultaneously increased its capacity to run daily tests. And every 1 to 2 days since then, we have opened up our criteria to additional groups. But we've wanted to do that slowly so that we don't overwhelm the system. And so it's difficult to predict exactly how many people we're going to be getting in who are ill and meet those criteria. So we'll be watching over the next several days to see if we have capacity to do more testing. But again, we need to do this in a cautious way.